Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae that is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Hello po, ako nga po pala si Ronaldine Rosales Batalier, 23 years old at ako po ay taga Bicol, Albay. Na-diagnose po ako nung taong 2015, which is ito po yung mixed germ cell tumor sa ovary. Stage 1 po ako nung diagnose ako. Tinanggal po agad yung right ovary ko noon. May nakakita sa akin na taga doon sa amin, sabi niya, what if try ko daw sumali ng contest? Tapos hindi ko nga sinabi na may sakit ako. Sabi ko, sige baka sakaling kahit paano may pandagdag kami sa gastos namin. Then noong 2017 po, yun na po, pabalik-balik yung lagnat ko. Siguro mga 2 weeks hindi ako nawawalan ng lagnat. Tapos yun na, pagpa-check up ko kasi lumaki po yung tiyan ko. Doon ko po nalaman na yung cancer ko daw, numerous to count na siya. Yung sakit sobra pa, yung nararamdaman ko, likod and sa stomach ko. Yun po lumaki po yung tiyan ko, hirap na hirap po ako. Nagawa po yung nakalatan na din yung lungs ko. Yung sa liver ko, kaya daw po lumaki yung tiyan ko, gawa ng sa liver po. Hindi na masyado nagpa-function yung mga organ ko sa loob ng tiyan. Yun po, ni-repair na po kami sa child house. And then, nung start na nag-chemo ako, doon na po kami tumira. Nag-stay na po sa child house. Akala ko okay na, wala na mangyayaring operasyon ulit. Pero nagulat po ako kasi every monthly check-up na lang po ako. Umuwi lang po ako sa amin tapos nagsusuka na naman ako. Akala ko kung ano na naman po yun. Yung dumi na ilalabas ko sa bibig na. Sabi ko, ano na naman to pa? Kaya na naman tayo, sisimula na naman tayo. May nakita daw po ulit na bukol sa diaphragm. Iyak na naman po ako. Sabi ko, hindi pa nga magaling yung sa ibang organ ko. Tapos ito na naman. Po as of now, wala na po akong treatment and may tumor pa po ako sa diaphragm. And lately, may nakita na naman daw po sa akin ng gallstone sa may gallbladder ko. Napansin ko po talaga, start po uminom ako nung Simply Nature, which is yung powder and tablet po na PPARs. Para pong, pag nainom ko na po siya before ako matulog, pag nakakainom po ako, parang nare-relieve, parang nare-relax po yung katawan ko. Siguro mga 2 days after na take ko po yung gamot, parang napansin ko na parang everyday na ako nagbabawas. Kasi po talaga dati, siguro sa isang linggo, 3 beses lang po ako nagbabawas. And nakita ko po talaga yung good feedback agad ng gamot na ininom ko. Kasi yun nga po, parang pag nainom ko po siya, parang yung sa loob ko na may something ako naririnig na tumutunog. And after yun po, nagbabawas na po ako. And parang ang gaan po sa pakiramdam. And parang medyo po nabawasan yung bloated ko sa tiyan. Start po nung uminom po ako. About po dito sa PPARs powder po, tinitake ko po siya every after meal. And based sa protocol po na ibigay po sa akin ni Doc Jansen, pag morning, which is 5 scoop, nilalagay po sa ilalim ng dila, and antayin mo po yun matunaw. Pag gabi naman po, tinitake ko siya after dinner, which is 4 scoop naman po siya. Kasi sa protocol po is kailangan everyday makatake ako ng 9 scoop. So, kapag po, based po sa observation ko, kapag po naiinom ko po itong PPARs powder,
Parang yung something na tumutunog po talaga sa tiyan ko na parang may something, parang kini-cleanse na yung sa loob ng tiyan ko. And after po nun, magbabawas na ako. So parang after ko pong magbawas nun, parang feeling ko sobrang gaan ng pakaramdam ko sa tiyan ko. Tungkol naman po sa PPARS Plus tablets naman po, based sa protocol po na ibinigay po sa akin ni Doc Jansen, ano po siya, kailangan everyday makatake po ako ng 30 tablets. So sa protocol po na sinusunod ko, iinumin ko po siya with empty yung stomach ko. Pag morning, pagkagising ko, ito po talaga agad yung iniinom ko. 15 tablets sa morning, and after naman po, same, kailangan empty din yung stomach mo. 15 sa morning, ng pagkagising ko, and 15 sa evening after dinner ko before ako mag-sleep. Kasi yun nga po, mas pinipili ko siya after dinner na lang po siya inumin para po agad, pag nainom ko po siya, yun nga po, nare-relieve yung katawan ko, parang mabilis po ako nakakatulog, and naiiwasan ko po yung insomnia na lagi ko pong nararanasan noon po, lalong-lalo na po nung after po ako mag-chemo. So yun. Daily routine ko, yun, gumigising ako ng umaga for exercise kasi yun din yung advice sa akin ng doktor ko. Kailangan may regular exercise ako and pagkain ng mga masustansyang pagkain. And yun nga po, nabanggit ko last time na mahilig talaga ako magluto. Yun po talaga, kapag kumakain po kami sa office, talagang ako po yung luluto po para sa pagkain po namin ng ibang mga kasamahan ko pasyente. As of now, thankful po ako kasi isa po ako sa nakatanggap ng scholarship sa isang magandang universidad dito sa Manila. Isa po sa nag-udyok sa akin para kumuha ako ng kursong education is yung mga bata po na kasamahan ko dito. So, nakikita ko po yung hirap ng papa ko. So, sinasabi ko sa sarili ko na hindi ako kailangan panghinaan ng loob. Kasi yung papa ko, nilalaban niya ako eh. Pero ako that time po kasi kapag naiisip ko yung taning ko, parang ang sakit po. Like, nakikita ko yung papa ko na lumalaban. Pero yung katawan ko, pakiramdam ko po kasi sumusuko na kahit yung utak ko, yung puso ko gusto ko lumaban. Hindi matutumbasan ng pasasalamat yung nagawa sa akin ng papa ko kasi talaga sobrang bait ng papa ko.
And nung November po is nag-CT scan po ako. Doon ko po nalaman na may nakita daw po na bagong tumor po sa akin. So that time, syempre, naisip ko na okay na ako tapos may nakita na naman po ulit na bago. So I am so thankful po kasi nung December po is nakilala ko po kayo. Nakilala ko po sila Mr. Shyan, sila Doc Jansen po at ang Simply Nature staff po na alam ko pong nakatulong po talaga sa akin. And yun nga po, nung nakita po na parang bad yung result ng CT scan ko, and after po ng December, after December po, and until June, July, nakatatlong CT scan po ako. At nakita ko po talaga yung improvement po ng result ng CT scan and ultrasound ko po. And I'm so happy po na nitong latest na CT scan ko nung July, tuwang-tuwa po si Doc Jansen kasi talagang nakita po niya na lumiit po talaga yung tumor ko. And masayang-masaya po ako doon. Siguro kung wala yung Simply Nature, siguro yung tumor na nakita po sa akin, I think siguro po mas lalala po siya. Kasi yun nga po ang sabi nila, kapag na-stress yung pasyente, mas lalo po yung nagtitrigger yung cancer po. Kaya yun nga po, maraming salamat po talaga sa Simple Nature kasi kung hindi po dahil sa inyo, siguro hanggang ngayon stop pa rin po ako sa pag-aaral. Ngayon po, gusto ko lamang po pala ipaabot ang aking pasasalamat kila Doc Jansen and Mr. Shyan. Maraming salamat po talaga kasi alam ko po talaga nakatulong po siya sa akin at alam ko pong mas lumakas po ako. And sabi nga po ni Doc Jansen na kahit slowly siya, sure naman po talaga na gagaling po ako. Kaya maraming salamat po sa walang sawang pag-support po sa akin.
Live Healthy Day, mga kasimple nature. My name is Jansen and Mr, a board-certified pharmacist and your health advisor here in Simple Nature. Welcome to another episode powered by SMG or Simply Healed Medical Group. Last week, Thursday, February 1, we discovered natural solutions for breast cancer in celebration of World Cancer Day on February 4. Moving on tonight, I'm going to give you some time again to call in your mother, your sister, your wife, your girlfriend, tita, and lola, because this is important, guys. Cervical cancer is the top 2 cancer in the Philippines. That's right, secondary to breast cancer. So for those of you who are taking cisplatin or suffering from fatigue, anemia, low platelets, nausea, and vomiting, I'm sure we are very excited to learn how to reduce the side effects and preserve the integrity of your immune system, to complete your concurrent radiation with chemo before it leads to kidney failure. So let's watch this.
So there is actually a way for us to minimize the toxicity inside the bone marrow, which is actually what I usually prescribe to patients, which is Simply Nature PPARs. Okay, because Simply Nature PPARs protects the integrity of the bone marrow. So even if you receive this, the radiation, the chemotherapy, yes, you will feel the side effects. You will still feel nauseous. You can still feel vomiting. You can still have vomiting. You can still lose your hair. But yeah, you won't have as much anemia. You won't have your immune system. The integrity of your immune system will be preserved. And of course, you won't bleed out because your platelet counts will still be there. Okay? So those are some of the benefits. So actually combining Simply Nature PPARs and with this treatment actually makes it more easy for patients to finish the chemo, the radiation.
Hi everyone, welcome to another episode of Simply Healed. We're so glad that you're joining us again on our regular slot on Thursday, the longest running cancer discussion forum program online right now.
Yep.
So Dr. Jansen, good to see you again.
Yeah, hello Shyan, hello everyone. Glad to be here again. Tonight, we're going to be discussing all about cervical cancer. Okay? So for cervical cancer, it's the second leading cause of cancer among women here in the Philippines. Cervical cancer is actually estimated to occur in about 7,800 women every year. And these are new cases. Okay?
Wow.
And then also, in terms of cervical cancer deaths, it's estimated to be around 3,800 every year. Okay, so this is actually a very common cancer among women.
But
okay?
it's also a very treatable cancer if you detect it
early. It's very treatable if you detect it early, but the mortality rate is also high if it becomes advanced already. Okay.
So Doc, what is cervical cancer? Maybe a simple biology lesson for all of us.
Okay, so just to be clear where the cervix is, okay, so this is the female reproductive organ. So the cervix is found here, okay? So it is actually at the collar of the uterus, okay? So this is what cervix looks like. So on the left is the normal cervix. So as you can see, the cervix is actually round in shape. It's like a donut, no? So it's like a donut. Then at the center, that is the opening. If you go inside that, that's going to be entering the uterus already. Okay, so that is what the cervix looks like. Now, this is the normal one. Now, this can change in appearance when a woman gets pregnant. Okay, but if a woman gets cancer, this is what it will look like. Okay, on the right. So here on the right, you can see a fungating mass, okay, a fungating tumor. You cannot actually see the cervix already. It's already very different, okay? So
is it painful?
Usually yes, but the pain is not excruciating.
Not like bone cancer.
Yeah, it's not like bone cancer. There is just a discomfort that you can feel, which one of the symptoms.
So that makes it even more dangerous because looking at the picture, it's not a good condition, but you don't really feel
anything. By the time that you feel symptoms with cervical cancer, usually it will already be in an advanced stage. Okay, so here are the symptoms. All right, so as you can see in the previous picture, you have bleeding. Okay, the cervix is actually bleeding, so you will have spottings, intermenstrual bleeding or bleeding in between your menstruation. You can also bleed more heavily when you are on your period. Okay? You can have an increased vaginal discharge, which has a fishy or a foul odor. Okay? For cervical cancer, there is a very distinct smell that when you smell that odor, it is almost always cervical cancer.
Wow.
Yeah, so next is unexplained persistent or pelvic or back pain, okay, especially in the lower back. You can also feel that, and pain during intercourse.
What should they
Tension,
do next if they have this like persistent pelvic back pain and then pain during intercourse? What's the thing that they should do?
Okay, you should go to your doctor immediately. Okay, especially to your OBs. So when you go to your OBs for a consult, explain the symptoms. Now, these symptoms, usually to diagnose or to suspect cervical cancer, it should be a combination of these symptoms. For the risk factors, what risk factors increases your chance to develop cervical cancer? So we know that the most common cause of cervical cancer is HPV infection.
Which can be vaccinated.
Yeah, you can get vaccinated for this. So watch our previous video to know to know about this. Okay, HPV infection. You have different types of viruses of HPV. You have the low risk and the high risk. It's the high risk HPV viruses that you should get vaccinated for, and it's the most common reason why you develop cervical cancer. Now, what are the risk factors? HPV or human papilloma virus is transmitted mainly through sexual activity. Okay? So if you have multiple sexual partners, if you are smoking, why? Smoking because it's just because smoking decreases your immune system, okay? It weakens your immune system, so that's why. Okay? Next is exposure to miscarriage prevention drug called diethylstilbestrol. Now this drug is mainly used way back in the 1950s. It's not used anymore now because it is cancerous. Okay, so
shouldn't be prescribed right now.
Yeah, shouldn't be. Okay, you should not be actually taking this. Okay, but for our grandparents and to some extent our parents who have who lived through the 1940s, 50s, okay, they might have had the exposure to this. Okay, so you have to be very, very wary about that.
But perhaps let's just go through screening and diagnostics.
So,
how would they go about screening and diagnosis?
Okay, so how do you screen for cervical cancer? If you want early detection, it's pap smear. Pap smear can be done once every 3 years for sexually active women or who have had a sexual encounter before.
Doc, you mentioned once every 3 years. So, important question right now is, how fast is cervical cancer? I mean, will it grow very rapidly? That if you are just unlucky that you're in between.
Okay.
So how fast is cervical cancer?
No, usually cervical cancer takes years to develop. Okay, so it's also a slow growing cancer early on. But if nothing is done, it becomes in an advanced stage, then it can grow very fast.
So pap smear is a good strategy.
It's a good strategy.
Ladies, don't miss your pap smear testing, especially if you have all those
risk
common
factors.
Okay.
So you know yourself. Okay. So another confirmatory test is HPV DNA test, which detects the HPV virus itself. Okay, which detects the high risk virus for developing cervical cancer. So that is also one of the screenings that you can do. All right. Next is biopsy. Biopsy is a confirmatory test. Then imaging studies that you can do is transvaginal sonography. So this can be used as a screening or staging. But when it comes to staging, we have limited information. So because you cannot see the lymph nodes with ultrasound, and you need to see the lymph nodes to properly stage cervical cancer. So next is abdominal or pelvic CT scan, which is the one that is used to stage cervical cancer properly. Okay? Now, let's go to the staging. So we have 4 stages. All right, so the first stage is when the tumor is still confined in the cervix. Wow. Stage 2, when it invades the uterus. Then stage 3 is when the tumor invades the pelvic wall, lower third of the vagina, if it already involved the lymph nodes, and if you already have a non-functioning kidney. Okay. So lastly, stage 4 is when you have metastasis to the distant organs already, like your bladder, when I say bladder, your urinary bladder, your rectum, the distant lymph nodes, the more distant ones, like your neck lymph nodes, okay, shoulder lymph nodes, your lungs, your liver, your bone.
So what I saw that was interesting or important to note is that you mentioned that if you have cervical cancer, and kidney functions
Can
get damaged,
yeah.
then can that actually lead to kidney like failure
Yeah.
while you are fighting cervical cancer?
Yeah, it can lead to kidney failure, especially if you cannot void normally already, and the pressure just builds up. Okay, so it can also happen.
No, I can also imagine. Wouldn't this have like a lot of other complications because you have toxins building up in your body?
Yeah.
You can't wee, and I'm sure
It's-
many other organs get.
Yes, exactly. Especially if both kidneys are affected, then you will have to go on dialysis.
Doc,
Right?
what about treatment?
Okay.
How does a person treat cervical cancer?
Primarily, on the early stages, cervical cancer can be treated using surgery, and it's really very, it's quite easy to do as well, because you just remove the uterus together, of course, with the cervix. You remove the ovaries, so actually it's you remove everything, the whole female reproductive organ. Then the prognosis of patients with this procedure is really good. Okay, because after the surgery, you just have to go on a brachytherapy. Then that's it. Okay, quite simple. But if the cancer already becomes more advanced, then surgery might not be an option already.
Because it's in more than one
Yeah,
location.
it's in more than one location, so it's actually not going to be wise already to do surgery, because even if you remove the tumor there, you have other locations that needs to be treated. Okay, so what we do is to go for a concurrent chemo and radiation therapy. So now, why should it be together? By the term concurrent, chemotherapy and radiation therapy should be administered together. Why is that so? So because for cervix, for the cervix is not it's an organ where the cells do not replicate that fast anymore. Okay, so if it's that way, then it won't be as sensitive to radiation. That's why you need something that will stimulate the replication of cells, which is chemotherapy. Okay? So you administer them together so that the radiation therapy will be effective. So now, what is that chemotherapy that is usually given to cervical cancer patients for this purpose? It's cisplatin.
Which is very important.
Yeah.
Later, the talk
Okay?
mention why.
Yeah,
Wow.
so cisplatin, as all of you know, it's both cytotoxic, and in this case, by the term cytotoxic, it directly kills cells. It directly kills the cancer cells, both the cancer cell and the healthy cells, okay? But you need this because cisplatin also functions as a radiosensitizer. So a radiosensitizer means it's something to make the radiation more effective. Okay? So it's given together. All right?
What are side effects to watch out for?
Side effects,
when you're going through
yeah,
this chemo?
because this is quite toxic. You can just imagine you just undergoing radiation
Both at the
therapy,
same
and then
time.
it's both at the same time, right?
Wow, that's
So, side effects to watch out for: anemia, fatigue, decreased WBC count, so you'd be more prone to infections.
Which, if you have a damaged kidney,
All
it's
the
just
more,
going to increase all the risk.
all the more bad news, no?
Yeah.
Nausea, vomiting because of the cisplatin, dermatitis, dryness of skin because of the radiation, bruising, bleeding because of decreased platelet count, and then UTI. Okay, so those are the side effects that you have to watch out for. Now, why is this so? Especially for anemia, fatigue, decreased WBC count, and the bruising and the bleeding. Okay, why do we have these symptoms? It's because cisplatin it's actually toxic to the bone marrow. Okay,
Wow.
it's
Yes.
these white blood cells, your white blood cells, your red blood cells, your platelets, all grow from the bone marrow. Now, if you damage the bone marrow, then naturally your WBC, red blood cells, and your platelet counts will go down. So there is actually a way for us to minimize the toxicity inside the bone marrow, which is actually what I usually prescribe to patients, which is Simply Nature PPARs. Okay, because Simply Nature PPARs protects the integrity of the bone marrow. So even if you receive this, the radiation, the chemotherapy, yes, you will feel the side effects. You will still feel nauseous. You can still feel vomiting. You can still have vomiting. You can still lose your hair. But yeah, you won't have as much anemia. You won't have your immune system, the integrity of your immune system will be preserved. And of course, you won't bleed out because your platelet counts will still be there. Okay? So, those are some of the benefits. So, actually, combining Simply Nature PPARs and with this treatment actually makes it more easy for patients to finish the chemo, the radiation.
And
Yeah.
we do know that the chemo radiation therapy, though difficult to endure, does work to treat and cure you of cancer. So together with the extract, Simply liquid extract, to work together to minimize all the damage.
Yeah.
This is just good news and good news and good news for all cervical cancer patients. And of course, for those of our viewers who are always very interested in natural, yes, have a consult with Dr. Jansen because Simply Nature protocols work very well in lifestyle medicine to provide you a natural approach to treating cancer. But we always talk about chemotherapy and radiation therapy because when cancer reaches the third and especially the fourth stage, time is of an essence. You don't want to stand on a ideological perspective. You don't want to stand that I am natural, I am what? No. I think when you're at fourth stage, you want to say, let me use everything that works.
Right? Use everything that works to increase the quality of life, to extend your lifespan. Okay, because time is more important now than ever.
Yeah, so once that's why for me and Dr. Jansen, we believe in natural too. I mean, that's why Dr. Jansen's a lifestyle medicine doctor, right? Using foods to heal. Yeah, but we do take time to talk always about chemotherapy and radiation therapy because many of our viewers are afraid of them. But please don't misunderstand. Dr. Jansen is vegan, right? He takes purely only vegetables. So of course, we are firm believers of the natural approach. But we have to, for your good, for the good of our listeners, we have to help you not be afraid so that if you really are in late stage cancer, you will use all the best options available to you. All right, so that's why we talk about chemotherapy and radiation therapy so often. So Doc, if we move fast, what is the success rate? And why for late stage cancer we would go to, use such strong therapy like chemotherapy and radiation therapy? What is the survival rates of cervical cancer?
The numbers that you see here, please try to understand how they came up with these numbers. So these numbers are the ones, the chances, the survival rates in 5 years. So if you first got diagnosed with an early stage or localized cervical cancer, then your survival rate is 92%. Why is it like so? It's because at an early stage, of course, if you know that you have cervical cancer at an early stage, you get treated. Okay? How do they treat the early stage cervical cancer? If it's so small, then just a simple biopsy will do.
Wow.
Okay?
And eat well, lifestyle medicine, and make sure you recover.
You survive. Okay? If it is a little bit big already, then do the surgery. Once you're done with the surgery, usually oncos are a little more, in Filipino we call it sigurista. More thorough. They don't want to take chances. They want a more aggressive approach, so they give you radiation therapy. That's why you have a very high survival rate, okay, for a localized cervical cancer. But when it goes regional, right, once it involves the other organs, when surgery is already not an option, then it decreases to 58%. Okay? Especially if you got diagnosed with stage 3, stage 2, stage 3, cervical cancer, then this is what happens, especially stage 3. Now, for distant cervical cancer, metastatic already, then chances is 18% of survival. Okay, so as you all see, for all cancers, the more advanced it is, when you get diagnosed first, then the prognosis is bad. It will be worse. Okay, so it's very important. Time is of the essence. Try to take action immediately. Okay, do not dilly-dally and try to go doctor hopping. Okay, if you see a good doctor that knows what he's doing, then go for it.
And as we talk about time being the essence, we also noticed that the questions are coming in. I can see some questions are focus on cervical cancer, but there are also other questions coming in general about other types of cancer. And of course, I see a few questions coming in about what foods to take, Doc.
Yeah.
So without further ado, let's move to our AMA Ask Me Anything segment.
Point questions are very much welcome. Just type them down in the comment section below. Kahit Tagalog, okay lang po. But just before we go to our AMA or Ask Me Anything portion, quickly, I just want to greet our avid viewers, Miss Edna Alarcon, Felicissima Siman, Nancy Ocampo, and Mau Zagot. Webinar is not the same without you guys. I would also like to greet our new viewers, Miss Elaine Joy, Lorena Santiago, and Iris Jimenez. We would like to invite all of you to a hybrid health seminar entitled Innovative Modalities in Cancer Treatment, Pushing Boundaries for Better Outcomes. Let's watch this.
There's a miracle in this simple nature.
Marami po akong natutunan dito sa seminar na ito.
I would recommend it to people who have illnesses, even cancer.
We are always with you from start to healing!
Hi, this is Shan, and I'm here to update you with a quick teaser. October 14th of 2023, we had our very first post-pandemic face-to-face conference on cancer, and it was a smash hit. The participants loved the ability to ask our panelists of myself, Dr. Jansen, our expert in lifestyle medicine, and Dr. Jimmy Katapia, who's our oncological surgeon. They were able to get all the answers they wanted about cancer and whether or not to go for surgery. So we are planning in 2024 another session by popular demand because everyone wanted to us to have another one so that they can bring their friends. So a quick teaser, we're going to have back Dr. Jansen, Dr. Jimmy Katapia, so all of you with questions on chemotherapy, on surgery, the doctors and the panelists are there to answer your question. And we have an upcoming special guest. We are hoping to get someone who is going to be an expert on diagnosis, something as very interesting like liquid biopsy, all right? So that's something new and on the cutting edge of cancer diagnostics. So those of you who could not make it for our face-to-face, well, this time round in 2024 on March 16th, we're gonna do ours with a Zoom option. So those of you who are in the province who can't join us here in Metro Manila, look out for the details so that you can join us on the Zoomcast.
Was for a ticket either on-site, face-to-face in SMX Aura, or online live Zoom webinar. So scan the GCash QR code flashed on your screen and send us the picture of payment to register. Or you can also find the registration link in the comment section. Yeah, now to answer your questions, in this modern world filled with noise of different health opinions, trust the ones from the experts. Of course, we have a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simple Nature International, our PPAR's expert live all the way from Singapore, Mr. Shyan Lim.
Hi Jen, and hi everyone. Good evening, everybody. And today I'm actually live from Singapore. In fact, I just touched down an hour ago, managed to rush back to be able to join everybody for this discussion tonight. Jen?
Yeah. We also have Dr. Jansen Kalalan, who graduated from St. Luke's Medical Center, College of Medicine, then was conferred as a diplomat of not only the Philippine College, but also the International Board of Lifestyle Medicine. He is also the medical director of SMG or Simply Healed Medical Group and a consultant at Alta Integrative Medicine Wellness Complex at Perpetual Health Medical Center, Las Piñas. Good evening, Doc.
Good evening, Jen. Hi, Shan. Hello, everyone. Happy to be here again.
Hi, Doc. So good to see you again.
I can see a lot of questions coming up and shown privately. So let us start the live AMA or Ask Me Anything portion. First question coming from Miss Helen Delgado Sabadera. Doctor, what is the sign and symptoms of cervical cancer?
Okay, the first telltale sign is vaginal bleeding. Yeah, and there is discharge as well, no? But typically, cervical cancer usually starts as a discharge, watery discharge that has a fishy smell. Then eventually, it can become bloody. Sometimes, if you are still in your
menstrual years, no, this can also manifest as heavy menstrual bleeding or spotting in between your menstrual period. So aside from that, you can also experience weight loss, which is a more non-specific symptom, but nevertheless, no, um, the vaginal bleeding is the one that is something that you have to look into. Okay.
Doc, I noticed there's a question from one of our viewers. She says that what if the vaginal discharge smells like rotting flesh? Should she be concerned? And what would you advise her to do?
Yes, of course you should be concerned. I mean, it shouldn't smell anything down there, right? So immediately, if there is something not normal, okay, there's something wrong, then most likely there is something wrong. No? So you have to go and get checked, no, by your OBGYN. Now, um, an odorous vaginal discharge doesn't always mean that it is cancer. Okay, it can just mean a vaginal infection. Okay, it can be fungal or it can be bacterial. Okay, that's why you have to get checked. Okay.
Okay,
So
next question
next question.
from Miss Maria L. Why is it common for unmarried women to have cervical cancer? Is that true?
No, it's not. Unmarried women, so singles, right? It Getting cervical cancer is not dependent whether or not you're married. Okay, it's dependent on the risk factors like do you
Sexually
have
active.
yeah, are you sexually
With
active? Do
different
you and
partners.
more yeah, and more importantly, do you have multiple sexual partners? Yeah, because you might not be sexually active, but I mean, your partner have had multiple sexual partners, so you can get infected as well. Or you might be sexually active, but you only have one partner, and your partner only has one, who is you, right? So that way you won't get HPV, which is the virus, the causative virus that leads to cervical cancer. Okay, so it largely depends on whether or not you are or do you have multiple sexual partners? Yeah, and
Or whether your partner that you are having has
yes,
multiple sexual
yes,
partners. So those of you who are
correct.
in a healthy marriage, your partner only has you and you only have them. And that's why if both of you are clean or both of you don't have the HPV virus, then you won't get cervical cancer. So that's a myth that married people don't get, I mean, that single people have a higher, no, seem to be getting, but then that we also understand from Dr. Jansen's answer why that is the case, right? So if you're single, but you're very careful, if you're celibate and keeping yourself for marriage, then you won't end up with cervical cancer.
Yeah, so that makes Zaina May wonder, are menopausal women prone also to cervical cancer?
No, it's not dependent on the age, not dependent. Okay, so it largely depends on whether or not you have had multiple sexual partners or your partner have had multiple sexual partners. Okay, so being menopausal has nothing to do with it.
Thank you, Doc, for clarification. Next question coming from Elaine Joy Bernales. If teens complain of stomach pain always, can we suggest a whole abdomen ultrasound?
Yes, you can, but depends on where the pain is located. So you can bring the patient first to a surgeon, general surgery, and see what the surgeon sees, no, in the abdomen. But typically, if the abdominal pain is located in either the right lower quadrant or the left lower quadrant, then there's something wrong. Okay. If it's at the epigastric region, no, just above your belly button, okay, at the epigastric region, then usually that just means that the patient might have hyperacidity or the patient might have had food poisoning. Okay, but if it's at the right lower quadrant, that's where the appendix is. If it's at the left lower quadrant, the patient might be constipated. Okay, so whole abdomen ultrasound won't necessarily show us what's wrong. It always should be correlated with the symptomatology of the patient.
Yes, or it would be sayang.
Yeah, but it's good that you asked this question so that at least you have a peace of mind and you know what to do next. A big shout out to Miss Janet Miss Janet Chua. Yeah. Janet, we haven't met up in person in a long time, but thank you for always watching our program. So a big shout out, Miss Janet is actually the director for Child House. It's a cancer halfway house, and it's a partner that both Dr. Jansen and I we support, and yeah. So those of you who are looking for a good how should we say, something good to do to cleanse and enrich your soul, and you want to volunteer, or do something to bless some kids, please give a shout out to any of our customer service officer, and we will actually connect you up to Child House, and you can always see how you can be a blessing to those who are less fortunate. Yeah. All right, next question.
Okay, going back to Miss Alma Narvaja. I was diagnosed with cervical cancer stage 1B2. I took my treatment last 2013 to 2014. I've completed all the treatments given. My doctor told me I'm cancer-free already. My last checkup was 2019. Do I have to be checked up again?
How old are you?
Mm.
I have to know the age. Yeah, because here's the guideline, no. I would still advise you to undergo regular checkups. Annual would be enough, no. So what if I am your doctor, no? What laboratory requests would I request? So number one would be a pap smear. Okay, your pap smear should be done every 3 years. Okay, this should be done until you are 65 years old and you have had at least 2 negative pap tests. Okay, so that's one. Another one is, of course, you were diagnosed with cervical cancer. Then I would advise you to undergo a whole, not a whole abdomen. It it would be a transvaginal ultrasound. Okay, at least a transvaginal ultrasound just to check if there are any masses or tumors that is growing. Okay, so basically just those.
Thank you, Doc. Next question coming from Phoebe. What if there's no chemo, only PPARs?
Okay, Doc will give you the medical answer. I'll give you the alternative answer.
Yeah, okay. Cancer has 10 hallmarks. Okay, so by 10 hallmark with with 10 hallmarks, no, there are 10 pathways that makes cancer that makes tumors a cancer. Okay, so if you are just utilizing one, or you are just relying on one mode of or one approach, no, you would only inhibit a few pathways. Okay, the other pathways would still continue to make the tumor grow. So in actuality, oncologist uses multiple chemotherapies, multiple treatment modalities to address cancer. So we cannot treat cancer with using one treatment modality alone. Okay, this applies to conventional and to natural treatments as well. Okay, so because of the 10 hallmarks of cancer. Okay, so if you just use PPARs alone, well, there are patients who improve, but it would be a gamble. Okay, so what if you don't? And if you just try PPARs alone, if it doesn't work, would there still be enough time to do aggressive enough treatment so your health doesn't suffer? So those are the questions that we doctors would have to consider, considering the patient's considering the patient's wishes that the patient wants just solely one treatment modality. Okay, so these things have to be explained to you, and you have to understand these possibilities. And if still you insist on you just want one treatment modality, then we will give. Okay, but at least you understand if it doesn't work. Okay, if an unfortunate event happens, you understand why it is so. Okay, yeah, so that's yeah.
I totally agree with Dr. Johnson. So if there's any one company that tell you, and also any one doctor that tells you just one modality will treat your cancer, I think you should you should do more exploration and more reading up on your own, right? As Dr. Jansen says, cancer is not like a flu, right? If you miss, or if you even give it a chance, what's at stake is your life, right? It's not another 2 weeks of coughing or something like that. Okay, so now so let's answer from the perspective of PPARs. Okay, personally speaking, and I think Dr. Jansen can probably agree with me, PPAR is really one of the best foundational things you can take, right? Whether you are going for chemotherapy or you're going for natural therapy, it's just something that's going to be so helpful, and it's going to be so effective on many levels, from controlling your inflammation to controlling your other comorbidities like diabetes, hypertension, blood cholesterol, and of course actually boosting your immune system, activating all your different pathways to fight cancer. However, with cancer, at the bare minimum, you have to at least engage your lifestyle, right? So please, for anyone, whether you're going for chemotherapy or natural treatment, you cannot say, I take chemotherapy and I don't care about my lifestyle. I think that one is very important. You got cancer without drugs. You got cancer without supplements. So the thing that caused your cancer is your lifestyle. You've got to make some adjustments to it. So the tips that we always share on our program, that is always very valid. Now, PPARs really is one of the best things you can take. Do we have patients that just did well on PPARs and lifestyle alone? Yes, we did. In fact, Dr. Johan, who is also another good colleague of Dr. Jansen, his protocol is only PPARs and food. So he really goes into lifestyle, and he shared on the program, I think 3 weeks ago, his success rate is about 60 to 70%, even for late stage cancer patients. So he has had good success. My advice is, I'm always very happy on top of your PPARs protocol. You want to take, for example, vitamin C, you want to take vitamin D, vitamin E. Yes, you want to take some other natural supplements. If you're not sure, you can always have a consult with Dr. Jansen, right, to ask if that supplement will be something that is safe and good to take together with whatever protocols you're doing. So the answer is, take your PPARs is one of the best foundational protocols you can. And even if you go natural, make sure you adjust your lifestyle. If you want to boost by taking other supplements like vitamin C, vitamin D, vitamin E, please go ahead taking turmeric, all right, curcumin. All these are wonderful. They all add up. Everyone adds up and helps you go through your cancer fight in a more healthy way, with less discomfort, less pain, and a higher success rate. So as Dr. Jansen says, fighting cancer is not a one bullet thing. All right, the more bullets you have, the better. But also, caveat, don't try every nonsense bullet out there. Yeah, sometimes they say, oh, Shen, since you said that, I'm going to try everything. So one of the simple no-nos in cancer is usually observe. Make sure it's a reputable company. Make sure that when you ask questions, they can answer you and it makes sense, all right? I think these are the due diligence you need to do before you take any supplements.
Yeah, so stay healthy, stay informed. Please don't forget to like our Facebook page and subscribe to our YouTube channel to replay and share with your family and friends our very informational weekly webinars and very inspirational success stories. Next question coming from Ms. Rapunzel Fuentes. Shout out, ma'am. It's my client. Is taking PFAS powder good for immunotherapy and radiation therapy?
Yes.
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 Short
And
yes.
Yeah.
Okay, there's no
do I need to explain?
No, I think we have an entire video on this one. Just look at our YouTube videos, look under immunotherapy. Dr. Jansen actually, if you want to learn what immunotherapy is, he actually gives a very good lecture. That one is not discussion, it's a lecture because it's quite detailed. All right, but in short, yes. And it will also prepare you for your immunotherapy, because many times before immunotherapy, you actually take chemotherapy first. But chemotherapy weakens your immune system, but they need to weaken the tumor before immunotherapy will have, so that immunotherapy will have a better effect. So taking PPARs will actually protect you during the chemotherapy phase, so that in the immunotherapy phase, it will even work even better. All right. So the answer is yes.
Very
So
good.
you should thank Jen for encouraging you to go on the PIPA protocol.
Okay. Next question from Miss Jen Chan Ang. If cervical cancer cells do not replicate easily, then does it mean it will take more years to have cancer symptoms compared to other types of cancer?
Oh?
Yes. Yes.
Oh,
You
that's
know
a good
why?
question.
Yeah, for cervical cancer, no, HPV especially, it takes quite a while for it to become cancer. Okay? Cervical cancer actually is a disease that is more common in elderly individuals, elderly females. Okay? It's just that we see cervical cancer in patients who are in their 20s because they've had, premarital sex during their teenage years. Okay? Because of, exploration. Okay? So, yeah, HPV virus, if you get infected by this, the body actually fights it off, no? And the only time that it becomes a tumor is when the type of HPV virus is high grade, or your immune system cannot mount enough or a sufficient immune response to kill them off. That is when it becomes a tumor. And of course, no, one other thing is that if the cancer cells, no, mutates themselves, they mutate that in such a way that they dodge the detection of the immune system, then that's the time that it grows. Okay, but usually it takes quite a while before it becomes a significant tumor that is visible to the naked eye. Okay, that's why pap smear is being done once every 3 years, and it's not done annually, because if you do it annually, then you will get false positive results that lead to unnecessary tests. Okay, so it's just done once every 3 years.
So I think this is also to answer Miss Annie's question. Oh, hold on. Sorry. Yeah. Hold on. Oh no, my camera. I don't know where it is. Okay, this is to answer Miss Annie's question. She asked, does she really need to go for a PET scan? And I think Dr. Johnson just answered it again, which is yes, annually if you've had cancer before, and 3 years, every 3 years, right, until the age of 65. Okay, so I think that's the answer. All right, so I'll just sign off for a little while to fix my camera thing, but please go on with the questions. Dr. Johnson will answer them for at that moment.
Okay, next question coming from Mayet Bellarmino. Can a cervical cancer patient survive or win this cancer without any radiation or chemotherapy because the patient choose alternative medication like herbals?
Very difficult, very, very difficult. It can, if you don't undergo any oncologic treatments, no, success, you'll have a good chance of success if it's stage 1 or stage 0. Okay, stage 1 cervical cancer, there's a possibility, but stage 2 and up, no. You have to have multiple treatment modalities being used on you. Okay, so this is also true, no, if you only undergo conventional treatment like chemotherapy, radiation therapy, and surgery, sometimes patients don't even survive, no. They get quite sick because cisplatin is quite it's a very toxic chemotherapeutic drug, and cisplatin's role in cervical cancer treatment is so that your cervix, no, the area becomes sensitive to radiation therapy. So it's a radiosensitizer. And of course, the side effects of radiation therapy, although it can really kill cancer cells effectively, it can also stop the bleeding quite effectively. However, the side effect of that is your immune system can go down. You'll feel fatigue, sometimes loss of appetite, which leads to more weight loss. And more weight loss means, more frailty, which impacts the quality of life. Okay, so you can get quite sick, and at this point in time, you'll need the supplements or the treatment modalities of the natural world, so to speak, or field, no? Yeah, so integrative medicine would be handy at this point in time. Okay, so again, if the cancer is advanced, locally advanced at that, don't just rely on one treatment modality. It should be multiple.
So this part, I guess I want to make a very strong, recommendation, on this program. We want to respect the views of many different doctors, but because cancer is such a serious thing, I do want to say that when it comes to cancer, do a all-round approach, all right? I am not advocating that you go and listen to your neighbor or your jeepney driver who recommends a wonderful supplement from their network marketing company and things like that. No, I'm not saying, you go and believe all the old, the folklore. No, no. But I'm just saying that, there are some oncologists or doctors who say, don't take anything else, just take a chemotherapy. They have good reasons for saying that, but more and more, but that is not really true. Okay, it's not the best strategy for you. And I think intrinsically, if you are watching this program, you are probably asking yourself the question, what more can I do if I'm having cancer and I'm going for chemotherapy, surgery, and radiation therapy? I think naturally, there are more things you can do, for as simple as taking your vitamin C, vitamin D, and E, right? And I'm sure you're now asking, what more can you do? So the answer is you can and you should do more, right? Because chemotherapy, though it is very effective for fighting cancer, it does weaken and damage your system. And you got to support your body if you're going for aggressive chemotherapy sessions and radiation therapy sessions, right? So one again, today in our program, Dr. Jansen is very a good example. He'll be able to share with you other protocols, not just PPAR protocols, but other protocols. And he's so familiar with the cancer therapy protocols. He knows the drugs, he knows the radiation, he knows immunotherapy. So I'm sure everyone, you feel confident of the advice that Dr. Jansen is giving you. So this is and I would say that you should find advice from people like Dr. Jansen or myself, where we are very careful about what we share with you, and we want you to do well. All right. So definitely, as a cancer patient, you can't eat everything. There are foods that will help you. There are supplements that will make things better. There are supplements that will not be good for you if you're going for your chemotherapy. There are supplements that will help you and make your chemotherapy even more effective. So PPARs is one of them. And if you are not clear and you want to have a better understanding, then go and have a consult with Dr. Jansen. I think I saw a viewer asking, how do you have a consult with Dr. Jansen? Just type there in Messenger, I want to meet Dr. Jansen. And then Ms. Beth will pick that up and give you a call, and then she'll help you schedule. If you want a face-to-face, let Beth know. If you want a Zoom teleconsult, which I always advise because you don't have to brave the traffic. And after your initial Zoom teleconsult, you can decide to go face-to-face if it's necessary, right? So that'll be the easier way. And last but not least, if you really want to ask even more questions, and if you would like to have a surgeon right beside us, right, then come for March 16. You get to see our very guapo Dr. Jansen in person. All right, Dr. Jimmy Katapia, who's our surgical oncological surgeon, will be sitting right beside us. And you can ask all three of us the questions at the same time. So wouldn't that be great? How many of you thought that's like the ideal circumstance, right? If only the person who is sharing with you the supplement is right beside your oncologist, then all your questions will be answered at the same time. So that's going to happen on March 16th. All right. Doc, there is a viewer that asked, she said that can she recommend to a doctor to have a hysterectomy? Wow. Yeah, okay. So for that viewer, do you know how serious a hysterectomy is? Basically, they remove everything. All right, that will definitely affect your life in a very real way. So if you ever want to have kids, it's no longer possible. Okay, and then it will also disrupt your hormonal balance in your body because you're removing a very major organ in your body. So, but I'm sure you must have a reason why you're thinking that. But let me ask Doc Jansen on your behalf some possible questions. Doc, as a preventive measure, Angelina Jolie made it so famous because she knew she had breast cancer cell in her genealogy. She had a double, not one, but double mastectomy. She removed her breast to reduce her cancer chances of developing breast cancer. Now, is that strategy even like a good strategy for cervical cancer?
For cervical cancer, no. For breast cancer, yes. Because breast cancer, if you have BRCA mutation, then prophylactic mastectomy actually is it can be actually a very a wise decision to undergo, because if you have the RCA mutation, most likely you'll develop breast cancer later on in your life. Okay? For cervical cancer, for that matter, no, there's no such thing as prophylactic hysterectomy.
Okay,
Okay?
so you don't do
Um,
preemptive. Yeah.
yeah, preemptive. Anyway, the cervix is located just below the uterus. It's not the uterus itself, no. It's the collar of the uterus. Okay? So it's like a gate that separates the vagina from the uterus. So that's your cervix. Okay, that's where cervical cancer develop. You cannot remove your cervix. Okay, because if you remove your cervix, then you have to remove the uterus. Okay, so you cannot uh undergo prophylactic hysterectomy, if there's even such a thing, or if it would actually be even considered in the future. No, we do it by vaccination. Okay, HPV, because HPV again is the causative agent of cervical cancer, and HPV is a virus. It's human papilloma virus. We have vaccines for that to prevent cervical cancer. For women, for men, it's penile cancer. Yeah, yes, penile
Oh,
cancer.
oh wow.
Yeah.
Okay, I didn't know
Okay,
that. Okay.
so yes, so men and women should get vaccinated against HPV. Okay, very important. All right.
So there you go. If you are looking for preventive, you don't have to do a hysterectomy, all right? So do a vaccination. Now, if you do have cervical cancer, uh, doc, I don't think you even need to suggest to your doctor for hysterectomy. Because if it's serious enough, your doctor will recommend it. If he doesn't recommend it, it's not one of those things that you want to do, that you are proactive in. It really is a major impact on your health, right? So I think doctors will try to not do a hysterectomy, especially doctors today. In the olden days, they used to cut every time. Yeah, yeah, last time they used to cut. Now they know that no, if we can preserve it, and there are many options to try first before we ever reach that very extreme option. Okay, so to that viewer, thank you for asking that question, because I'm glad we might have stopped you, or at least give you food for thought to not approach that without deep consideration. So again, consult with your doctor.
Speaking of hysterectomy, question coming from Rizal Merano. Tabso patient, isn't need yearly pap smear?
No, you don't. Okay, Tabiso. What is Tabiso? Okay, it's a surgical procedure. So it's an acronym actually. No, it stands for. Please bear with me. It's a mouthful. So it stands for total abdominal hysterectomy with salpingo o oophorectomy. So what does that mean? It means they remove your uterus, they remove your fallopian tubes, they remove your two ovaries. That's what it means. Okay. Now, even if you have had cervical cancer, no, then you underwent then that procedure, no, Tabiso, you don't have to undergo pap test yearly. It's still every 3 years. Especially if it has been established that you are cancer free. Okay? It's still every 3 years. Okay?
Okay, thank you, Doc. Next question coming from Maria L. Having cervical cancer can be inherited or within bloodline?
It is acquired. It's not inherited. Okay? However, there are genetic susceptibilities that can run in the family, which makes your immune system have difficulties in fighting off the HPV virus. Okay? Which makes you more prone to develop cervical cancer. But cervical cancer per se does not run in the family. Okay, it's just that there are genetic susceptibilities which runs in the family that makes it more difficult for you to fight off HPV. Okay,
So,
I hope you
Doc,
understand.
yeah, to make this very, very clear. So even if you had an auntie, two aunties who died from cervical cancer, but if you stayed a virgin all your life, there's a 0 chance that you will develop cervical cancer. Yep. Okay. Right. So we are very clear. It means that cervical cancer doesn't come out from your genes. It's something that you acquire, right, from a virus. Okay. There we go. I think I think that advice that illustration is, I hope that will clear up for everyone. I saw one, Jen, that I wanted to touch on. I think, how do you pronounce that? Urieta Estrada. Yeah. Ask, can PPAR drugs be an adjunct to chemotherapy or okay. Okay, yeah, you can see Dr. Jansen nodding already. The answer is yes and absolutely yes. You know, we went so far as to actually test PPARs on chemotherapy drugs. All right. So what does it do if you take PPARs not to treat cancer, but if you take it with the goal, all right? You take it, it's like a spoon, everybody, all right? You know, I just want to give an example, right? You can use a spoon to drink soup, but you can also use a spoon to cut a cake, right? It depends on what you want with the spoon, okay? But the spoon can definitely do both, okay? Now, for us, there are people who use PPAR protocols as a primary natural therapy. So they use it for treatment, okay? Yes, it's very effective for that. Now, there are also people who use PPARs for adjunct therapy and adjunct support for chemotherapy. And we actually did trials to prove that that works very well. What it'll do is to protect your organs, the rest of your body from the damage on chemotherapy. And there are specific places that we really, really want to protect. We want to protect your bone marrow because that's where your red blood cells and white blood cells are matured or formed. So that's also an integral part, very important part of your immune system. And for chemotherapy protocols, the moment your red blood cell count and your white blood cell count goes down, especially your red blood cell count, your onco will say we can't continue with the chemotherapy, which is not good news because if you go halfway, you don't get the benefit of chemotherapy. So maintaining your high red blood cell count throughout your chemotherapy is a very important part of you being able to go through chemotherapy successfully. So this is where taking PPARs as PPAR extracts, specifically the extracts, will help you do that more successfully. It also make you feel stronger, protect your other organs, bring down your comorbidities. You don't want to go through chemotherapy and diabetes at the same time because that will make you susceptible to other diseases that will come, right? And of course, diabetes weakens your immune system, and the chemotherapy also hits and stresses your immune system. So you don't want all that on your immune system. So the answer is yes, it will support as an excellent adjunct therapy. And Dr. Jansen had so many successful cases with this. Yeah. Yeah, Jen.
Thank you, Sir Sean. Next question coming from Fatima Bukalid. Cervical cancer vaccine, is it effective, Doc? And how many times it should be given? And what age should it be given?
Come again.
Is it effective? Is the vaccine
Cervical
effective?
cancer vaccine,
Cervical
is it
cancer
effective?
vaccine.
Yeah, and how
Yes,
often,
it is.
and
It
how
is.
often
If
you have to
you
take it? Is it like COVID, you have to take so many boosters?
no. For cervical the HPV vaccine, no, you only have to take it 3 times. Okay, so the first dose, then you'd have to take another one after 1 or 2 months, then take it at the 6th month. Okay, so 3 doses only. That will give you lifetime immunity.
Lifetime, everybody.
Yeah.
Lifetime. All right.
Okay, so that's why it's really very important. And just my 2 cents, no. There are different types of HPV vaccine in the market. There are cervical vaccines that gives you immunity to 2 strains of HPV. There are HPV vaccines that gives you it gives you immunity to 4 strains. Then there's another one that gives you immunity against 9 different types of HPV. So if you can afford it, my suggestion is to go for the 9. Okay, Gardasil 9. That's the brand name of the vaccine. So you can ask for that from your doctor. Okay. If budget is a little bit tight, then you can go for Gardasil, which gives you the regular Gardasil, which gives you immunity against 4 strains of HPV, and Cervarix, which gives you immunity against 2 strains of HPV virus.
You know, Doc, I really want to thank you for bringing this up. You know, I will definitely advise my niece to go for vaccination. And the reason being, I'm sure all our viewers out tonight are very responsible in their sexual activity, right? I'm sure you're very careful about your partners. But here's the thing. Maybe your partner was not careful in the past. all right? You may be very careful and you may be very conservative and you don't have many sexual partners, but your one or two partner that you have may have had 20 partners and he didn't tell you. You know, he may have a bad boy phase, you know, that you didn't know about. Or and nowadays it's not only bad boys, it could be bad girl phase that she never told you about. So for that purposes, if you know, getting yourself vaccinated protects you from your partner's history as well. So I think that's just something that is worth thinking about and acting on. So get yourself vaccinated.
Yan. More on the cervical cancer vaccine. I guess that answers the question of Miss Fatty Tabing. Next question from Jen Chan Ang. Why is cervical vaccine applicable only until age of 40? This is per a cardiologist. Is that true, Doc?
Yes, that's true. That's true. Actually, we can stretch it until age 45 if you have the Gardasil 9. Okay. The reason why is because at that point in time, no, if you are more than 45 years of age already and you have had negative pap tests, you were faithful, or if you know at that point in time you do get naughty at that age, no, there's a very small chance that you do develop cervical cancer already. Okay, so you see, it takes decades for it to develop. Okay?
Also, so Doc, what you're saying is that if you got naughty, okay, when you're 45, it takes too long for you to, unless you're gonna live to 100, there is very little chance for the cervical cancer to actually have enough time to develop it. Is that what you're saying?
Yes. You know, another factor, you know why? It's because of the age of the body. It's because of the age of the person. So cervical, no. The HPV virus, when you get infected, the older you are, the slower it spreads or the slower it multiplies.
It's got to do with your own hormones, how active it is. So older person, it's
actually it's more of the age.
age,
It has
right?
something to do with how how active your cells are replicating.
Replicating. All right.
Yeah.
Okay,
So as we get older, yeah, it slows down. That's why, you know, people get wrinkles in the first place. But if you're younger, then your cells would be more active. They replicate more actively. They replicate faster. That's why if you got infected with HPV at a very young age, you know, especially if you are in your teenage years, then you know, in your 20s, you do develop cervical cancer. And that is a very, very aggressive cancer. Okay, so you're the treatment, yeah, because if you're young, yes, correct, yeah.
Isn't it wonderful, everybody? You know, you hear from your doctors about these rules, but you never understood why. But you know, on our program, you actually find out why those above 45 don't need to get vaccinated anymore. So you're not just a rules person now, you actually know what you're doing. So a big clap to that question. All right, so now you're one step closer to being an amateur doctor.
More on the vaccine. Question coming from May Aiden Dupingay. Good evening, Doc. In regards to HPV vaccine, at young age of 9 to 14, DOH is implementing or promoting this vaccine to them. My question is, if they receive the vaccine at those young age, will it be a lifetime protection against the virus? Thanks.
Yes. The answer is yes. So depending on what you receive, no, what kind of HPV vaccine you receive, you'll be immune against the strains, okay, that those vaccines contain. Okay, so the more strains that you get protection from, then the better. However, this is not a
license.
It's not a perfect shield, so to speak. No, it's not a perfect shield. Okay, because this shield has vulnerabilities. Okay, so what is the vulnerability? You only get immunized against the HPV virus that the vaccine contains. Okay, there are a lot of HPV virus strain, actually more than what the vaccines has. Okay, plenty. We actually have 35 strains, I believe. Okay, 35, and you can only get protection from 9 in this day's technology. Okay, so yes, if you do get vaccinated, chances are you won't get cervical cancer because you get vaccinated against the viruses that against the HPV virus strain that gives you a very high chance of developing cervical cancer. However, it's not 100%. It's not 100% chance that you won't get cervical cancer already in the future. Okay, because what if an HPV virus strain has a small character that it can, or small chance that it can produce cervical cancer, and you have the susceptibility, that you have the genetic susceptibility of developing cervical cancer, then you will get it. Okay, so but that is quite rare. Okay, and do we have anything that we can use to detect this genetic susceptibility? We don't. Okay, that's the unfortunate thing. But it's just good to know that, okay, or just to set the expectations of people, no, that this is what we have now. Okay.
Last question about the vaccine. But if you have been diagnosed with cervical cancer now already, is it still necessary to have it, or it will no longer help?
Yes, it is still necessary because the HPV virus does not only cause cervical cancer; it can also cause warts. Warts.
So
Yes.
so you kill two birds with one stone, right? And of course, there are other strains of HPV virus. So protect yourself from, developing another strain of cervical cancer as well. Many people, we always hear things like I have breast cancer, I have cervical cancer, I have bone cancer. I was just talking to Dr. Jansen, one of our mutual client patient. Her cancer had 4 different types of breast cancer cells in one breast cancer, right? So many times we, as patients and in general, when we speak, we say breast cancer, but actually there are many types of breast cancer. So just because you are you got one doesn't mean the others won't come, right? So even if you beat the battle once, you just have to still be careful, right? You still have to live right so that you will be healthy.
Okay, moving on to next question from Golden Lion. What is the best appetite stimulant for cervical cancer patients?
Golden
Appetite.
Lion. I love the I love
Golden
the
Lion.
It's very Chinese New Year,
Yes,
Golden
yes,
Lion.
Chinese.
All right, okay.
A good appetite stimulant, B complex, vitamin B complex or multivitamins would be good. What else?
I'm gonna say, try our BPA extracts, or if
Yeah.
that's not what you want, or even at least the BPA tablets, because
Mhm.
sometimes our appetite is suppressed because our body is weak. Yeah. So when you get stronger, you burn more calories, your body feels hungrier, your organs are healthy, they need more energy. Yeah. So that's also one possibility. And of course, while you're doing that, you're going to have the effect on your cancer treatment, the positive effects on your cancer treatment. So which is why I always say that the PPR's protocol is one of the best protocols you can have, both for adjunct therapy, supporting all these things, as well as a primary first foundational protocol if you're going for natural.
Yeah.
Okay.
You can use PPARs. Buclizine would also be good. Mosegor, that's a brand, no? That's a supplement brand. The those are the supplements that other doctors prescribe to the patients that I've handled. Okay, so other doctors actually do recommend those supplements. So you see an insider info among the medical community on what we tend to prescribe. Okay, so me personally, uh, I tend to gravitate towards Buclizine and Mosegor. Those two. Yeah.
Yes, and those are over-the-counter medicines, so you can just go up to your pharmacy.
Yeah, and
without
no,
prescription.
because our Jen is a board certified registered pharmacist. All right, so those of you who are very blessed to have Jen as your, supporting you as those of your clients, you can ask her everything about drugs. She's actually a pharmacist. Okay, yeah. All right, Jen, I think we have such a great audience tonight. Maybe one last question. And to everyone, as you can see, we are very happy to answer questions, not just about tonight's topic, but also ask us anything. All right. So Like, if you want to know if Doc Jansen is still available, he's not. He's gonna get married soon this year. Okay, but no, jokes aside, no, we really thank you guys. It's so great. The audience today is such a surge of audience, great questions. But time is short, so join us again next Thursday. But before we go, we'll answer one more last question. So Jen, pick a good one for us to end tonight with.
Okay. Last question coming from Angelica Larioque. Can endometriosis lead to ovarian cancer?
Ah, interesting. Okay, here's the thing. Okay, very good question. You guys are thinking, okay? I like it. Okay, ovarian cancer has many types. Okay, and sometimes, okay. First, let's establish what endometriosis is. Endometriosis is when the endometrium, no, the endometrium is the inner lining of your uterus. That is what gets sloughed off during menstruation. And during menstruation, if the menses, if the blood is really, if the volume is too high, no, the endometrium can get thrown elsewhere. Okay, sometimes it gets thrown off to the ovaries. Okay, that is what we call as endometriosis. Endometriosis does not, the ovaries is not just, it's not the only organ that gets, that receives the endometrium. There are other organs that can get endometriosis, no? So, but if it does get into the ovaries, then that can actually be a risk factor for developing ovarian cancer. Okay, because we have a type of ovarian cancer which is an endometrial cyst. An endometrial cyst is when your endometrium, okay, a tissue inside the endometrium gets thrown off, no, to the ovaries. However, it does not always happen. Okay, actually, an endometrial cyst is not a cancer. It's a benign tumor that enlarges. Okay. Yeah. So that's one factor that yeah, it can lead to cancer, but not always. Okay, it just increases the risk. Okay, because developing ovarian cancer, endometriosis is not part of it's not a risk factor for developing ovarian cancer. But sometimes when you develop endometriosis, that endometrium that gets thrown off to the ovaries can, react, inflammation can happen, that, it turns it into an endometrial cyst. An endometrial cyst again can enlarge. Okay, so that's it. Very good question.
Very good question. And I would take this opportunity from this question to start my last words. My final contribution for tonight is this. That question is very good because it's a preemptive, right? And it highlights one point. If there's anything not right with your body, there is nothing that you should ignore. Everyone, I think that's an approach to health. There's nothing you should ignore. All right. So as some of you might know, I have a very strong interest in TCM, and I'm actually taking a TCM program right now. But prior to that, when I ask a TCM doctor, so it's very different, when I ask a normal conventional doctor, if I'm either sick or not sick, diba? I'm either sick or healthy. If I ask Dr. Jansen, the answer will be slightly different. I think it'll be more closer to TCM. Okay, but if I ask a TCM, he will tell me she has never, or it's a female TCM. She said she has in her whole life, she has almost never seen a truly healthy person. We are always, we may not be sick, but we are not truly healthy. We are on the verge of developing something, maybe not immediately, but some diseases like tonight's cancer topic, cervical cancer, takes decades to develop, right? So we are always off balance one way or the other. So we should go through life with this consciousness to constantly adjust as well. So for example, if you ate too much ice cream, right, and you feel a cough coming, stop eating ice cream. and then maybe stop drinking, even drinking cold water, drink warm water. So this last question about endometriosis becoming a cervical cancer is in line with this. If you feel something's off, asking questions and doing something about it is important, and it will save you a lot of pain. Now, the question is, if you go and ask a doctor, then you are not sick. So the answer is very absolute. Because doctors don't prescribe drugs, because drugs have side effects. So they don't use drugs callously. So then in that case, the best thing that you can do every time you have these things is look for natural adjustments. So Doc Jansen is perfect for this, because you can go up to him and say, Doc, take a look at what I'm eating. What's my lifestyle, right? And I have this endometriosis. What can I take that will generally steer my body away from this over a period of time, right? So then he can really advise you. So that's why supplementation is important to keep yourself healthy. Prevention is better than cure. All right. So with that, Doc Jansen, your final parting words.
Yeah. So thank you everyone for attending and for staying with us until this time of the night. I hope you learned a lot, and there are actually a lot of really good questions, no. So it's really good that we have these kinds of quality questions. So we have a very good discussion. I think that's it for me. I hope to see you again next week. Okay, we have a weekly episode anyway. So for those patients or those people who we weren't able to answer the questions, please ask them again next week. And who knows, we might be able to answer your question. Okay. So thank you everyone, and good night.
And again, for those of you who really want your questions answered, you can type private message, Jen. Please ask these questions, because sometimes Jen and Sheila will actually prepare the questions from previous week. So Jen, please let our wonderful viewers know what's our topic next week. And me and Dr. Jansen will see you guys next week. Good night, and have a Happy Chinese New Year. 恭喜发财 to all those who celebrate Chinese New Year.
Thank you, Sir Shyan. Thank you, Doc Jansen. I'm afraid that's all we've got time for today. We hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. For next week, February 15, we will embrace a heart-healthy lifestyle. Heads up, next week, we're also going to have a Sulit Sweldo sale on Lazada Mall from February 13, Tuesday, to February 17, Saturday. And again, on March 16, Saturday, we're calling all patients, survivors, advocates. Let's all come together to explore the latest advancements in cancer treatment and engage with multidisciplinary experts dedicated to enhancing your well-being, including Doc Jansen and Mr. Shyan themselves, also Dr. Jimmy Katapia, a surgical oncologist at Manila Medical Center. Limited slots only, so don't miss out on this opportunity to be part of a transformative experience. Reserve your seat, scan the GCash QR code, bring your friends, and let's embark on a journey to a healthier and happier you. Only 150 pesos for ticket, either on-site, face-to-face in SMX Aura Taguig, or online live Zoom webinar. Lastly, we're on the lookout for compassionate and proactive individuals to join our team as we expand and we aim to reach more patients in need of natural health solutions. If you're eager to grow with us and thrive in a dynamic environment, we'd love to have you on board. If you're interested, send your resume at vilma@simplynature.asia. Thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we are always with you from start to healing. Thank you everyone, good night, and God bless you all.
There's a miracle in this Simply Nature.
Marami po akong natutunan dito sa seminar na ito.
I would recommend it to people who have illnesses, even cancer.
We are always with you from start to healing!
Hi, this is Shan, and I'm here to update you with a quick teaser. October 14th of 2023, we had our very first post-pandemic face-to-face conference on Cancer, and it was a smash hit. The participants loved the ability to ask our panelists of myself, Dr. Jansen, our expert in lifestyle medicine, and Dr. Jimmy Katapia, who's our oncological surgeon. They were able to get all the answers they wanted about cancer and whether or not to go for surgery. So we are planning in 2024 another session by popular demand, because everyone wanted to have another one, so they're carrying their friends. So I'm gonna have Ben, so all of you with questions on therapy, on the doctors and the panelists on their question, have an up special, hoping to get someone who is gonna be an expert on diagnosis, something as very interesting like liquid biopsy, all right? So that's something new and on the cutting edge of cancer diagnostics. So those of you who could not make it for our face-to-face, well, this time round in 2024 on March 16th, we're gonna do ours with a Zoom option. So those of you who are in the province who can't join us here in Metro Manila, look out for the details so that you can join us on the Zoom cast.